I always like meeting new people, oftentimes in the studio, but that doesn't seem possible anymore because of COVID-19 restrictions. So we're doing most of our visiting with guests on the phone. And I have somebody who I have not had a chance to meet in person, but I have just spent a moment or two talking to him off the air. And that's Dr. Richard Barron, who is the new, relatively new this year, Executive Vice Chancellor for Health Affairs at the University of Missouri. And he also has responsibilities with the Next Gen institution. And so Dr. Barron joins us now. Sir, good morning. How are you today?
I'm good, David. Thank you so much for inviting me to be on your program. I've been when I heard that you wanted me on, I was excited because your reputation precedes you.
Well, we'll leave that one just right there and say, well, thank you. That's very nice of you.
Yes.
So my first question for you is, when did you begin the job here at MU?
Well, I started, my first official day at work was May 11th, but when President Choi offered me the job, I believe it was February 28th, I think I essentially began working for MU on March 1st in Kansas City. And so during that transition time, I was really plugged into everything that was going on. And of course, COVID hit the second week of March. So even when I was still in Kansas City, as we set up our incident and command here at University of Missouri Healthcare Center, I was involved in that. And by the time I got here in May, I actually felt that I knew a lot of people virtually.
Sure, I understand that. And
Yeah.
that's interesting time to switch jobs and also to take over a job of the magnitude that you have, which is going to be impacted greatly by what was happening with COVID-19. How hard or how challenging has it been to say, I got to get adjusted to a new place. I expected to be doing this when I accepted the job. Now, all of a sudden, we are faced with this.
Well, this is such a great institution at University of Missouri and at the Healthcare Center that it actually was a pretty easy transition. And while the COVID pandemic has just serious implications for all of us, to some extent, it really cleared my schedule, and I was actually able to get here 6 weeks earlier than I had originally planned. Originally, my transition was going to be July 1, and then when COVID hit and everyone went into planning for how we're going to react to the COVID, both at KU and at MU, it just seemed, and all my travel evaporated. All my overseas and continental travel evaporated. So I actually accelerated my move here, and that way I was able to fit right in pretty quickly. And, a lot of the routine stuff wasn't happening. So we in April and May and June, we were really doubling down on how to deal with the COVID pandemic, and I think we did it very well here. So I really was able to get focused, was able to meet with all the leadership daily, and now over the last couple months, I've been sort of shifting into, okay, now what do we do to continue our mission in face of COVID?
I think that's a pretty apt observation and a good perspective, because you're right. When COVID-19 hit, a lot of our schedules did change. So we were given an opportunity to prioritize and maybe to step back from some things that were important, but were not as important. So I like what you said. I think that's a pretty good view of it. Here's my question for you now, though, as we kind of get a feel for what you're doing at the University of Missouri. Executive Vice Chancellor for Health Affairs and Executive Scientific Director of the Next Gen Precision Health Institute. How do you tailor your day so you could do both of those?
Oh, I thought you were going to ask me what does that mean, which is what my mother asks me all the time.
Hey, I'll get to that. I'm not sure what it means to be the Executive Vice Chancellor for Health Affairs, because I don't know how that all fits together with the CEO and with the med school and all the other titles that go there. But as I understand it, you're the top person when it comes to probably MU Healthcare and anything else that has to do with healthcare.
Thank you, David. That's a great setup for me to explain what my role is here. And you're absolutely right. They haven't had an EVC of Health Affairs here for a few years. There used to be one, and when he retired, that position hadn't been filled for a few years. So essentially, the CEO of the hospital, Jonathan Curtright, and Dean Zweig were reporting directly up to the chancellor and the president. But there needed to be a focal leader that the CEO of the hospital and the dean of the School of Medicine reported to and work with closely. And so that's what the EVC of Health Affairs does. So I'm here to coordinate the activity between those two extremely important healthcare entities at the University of Missouri. And without they go hand in hand. I mean, the hospital success creates School of Medicine success. School of Medicine success, it's recruiting faculty, improves the hospital's chance of success. So they're absolutely tightly integrated, and I'm here to coordinate that activity. In addition, I think it was in April, before I arrived on campus, President Choi called me up on a weekend, as he does, and he said, "Rick, I want you to do something else for me. I want you to also take on to be scientific director for the Next Gen Institute." Now, I had been studying the plans for the Next Gen Institute as I was interviewing for the job, and after the job was offered to me, so I was really excited about it. But then when President Choi gave me the opportunity to actually be the leader of that initiative, it was even more exciting because it really was able to tie everything together. The Next Gen Precision Health Initiative is the focal point where we are putting a lot of our resources in order to advance healthcare research and discovery so we can improve the health of Missourians. And obviously, it sort of makes sense. That ties into what we would be doing in the hospital, in the School of Medicine. And so leading those three endeavors is what I'm doing. And I basically, it really has come down to splitting up my time. It's about a third, a third, a third. So in any day, it breaks up about that way. 1 hour I may be focusing on the hospital, the next hour on the School of Medicine, the next hour on Next Gen, and a lot of the leaders overlap. So that's what I'm doing on a day-to-day basis.
Wow. A lot on the table. I appreciate you taking the time to join us. Again, we're talking to Dr. Richard Barron, and he is at the University of Missouri, and we just talked about his roles as the Executive Vice Chancellor for Health Affairs and the Executive Scientific Director of the Next Gen Precision Health Institute. You do not get any jokes from me about coming from the University of Kansas, so you can just rest assured that I understand the rivalry, but I think that's kind of childish at times.
Can I tell you one of the best jokes I heard, David?
Okay.
So I was talking in front of a Rotary Club a couple weeks ago, and I always say that I was on loan to the state of Kansas for the last 20 years, and that always gets a little chuckles. And then one of the Rotary Club members in the audience said, "Oh, were you the guy that was in charge of the social distancing at the KU football games?"
They had social distancing at those games prior to this year when the virus.
Exactly.
I understand the joke. One of the reasons I brought that up, though, is a couple of years ago, there was and I'm bringing this up as an example of what I think that the University of Missouri hopes you will do for it, because there was a $25 million grant from the NIH, National Institutes of Health, to the University of Kansas research efforts. And one of the things that I'm leading to, and a question for you is that, as I was reading about this, and that was in the Biz Journal, someplace that covers what happens in Kansas, and it was talking about Kansas Med and research there and making strides and discovering some of the ways that we will be treated medically in the future. And I'm thinking those are some of the same promises that go along with the Next Gen facility. So I say we are not unique in trying to go down this road towards this precision medicine and health. But where are we unique, and why why take over that role here when it's being done elsewhere?
That's a good question. So I'm glad you brought up the $25 million award at KU. So I actually was the principal investigator on that big NIH award. So I had a big team that helped me get that grant, but it was a huge grant for KU, and we got it renewed. So it actually was $50 million. And it was an effort to really up our game at KU, to really go all in on clinical translational research. So wet lab research, very important, but this is really research that directly impacts patients in healthcare. And so that really got us on the radar map at KU when we got that award and a couple other big awards. So I think one of the reasons Dr. Choi and the leadership here and the search committee recruited me here was to try to achieve some of the success that me and my team was able to have at Kansas, to do that at Missouri. We have an unbelievable depth of talent here at the University of Missouri, and we're in the AAU, but our NIH research funding could be higher. And so and it was the same when I got to KU 20 years ago, and we were able to double the research funding at KU. And President Choi's and my goal and all of our leadership's goal is to double our NIH and other research funding here as well over the next 5 years. So while any upper-tier AAU institution, the goal is to increase healthcare research, improve the health of the community and of the region and the state that they're in, and so we're no different from any other institution in that regard. Where we are different, I think, is putting this emphasis on precision health, getting the right treatment to the right patient at the right time. And that is what we're doubling down on here by building this building, the Next Gen Precision Health building, by creating a Next Gen Precision Health initiative that's system-wide, and by really focusing on all types of precision health, from the test tubes with gene therapy and targeted therapies for different diseases, to population health research, where we emphasize improving the health of rural populations, diverse populations. I think doubling down on that part of the research piece it does separate us a bit. It certainly separates us from my prior institution.
I've always felt like there are good researchers at the University of Missouri. How well are they connecting with each other? And are you overseeing, say, I get an idea of, okay, here's what we've got. Here are a lot of strengths. They could connect this way a little bit better. Or maybe there's some gaps here and we will fill in the blanks here.
Now, that's really a good observation. I think I am known historically as a good connector. I did that in my prior academic jobs in Kansas and in Texas, and I actually like to bring people together from wet labs, from the clinics, and try to get people in the same room and to find out what everyone is doing and do some matchmaking. Actually, that's exactly what we're doing now in finding who are going to be the first wave of scientists are going to be in the Next Gen Precision Health building. So we have a group of faculty research leads in our areas of focus, and we're going through all of our faculty that are involved in healthcare at the University of Missouri, and we're selecting the ones which we think would be the best fit for the building, not only because they work together now, but because they have the potential to collaborate with other research groups. And so we're going to have that list completed, and we'll have our first wave of inaugural Next Gen Precision Health scientists that'll go in the building, which opens October 2021. But we're selecting them now, and I sent that as a slight joke to my faculty research leads. I feel like we're selecting the first Mercury astronauts, and there'll be a picture of them all eventually once we select them, and so it's really exciting. So you're right, connectivity is important. Team science is absolutely critical. You cannot advance the ball in healthcare research these days without team science, and that's one of our motivating principles as we move into the Next Gen building.
I will say that there are probably some listeners saying, I don't get the reference to the Mercury astronauts, but I am old enough to remember that picture of them, so it makes sense to me, I understand it.
It does date me. I know it dates me. I'm sorry.
Well, I'm in the same date, so that's no problem. So let me see if I understand this. You are looking at in-house or MU researchers. What do you think is going to be the mix of those who will be new to the University of Missouri for this Next Gen Institute and those who will already have been here, just finding a different office and a different lab and a different role?
Yeah, so it'll be about 50-50. And let me emphasize that we have been really busy recruiting over the last year, building up to this point. And some of these recruits have just arrived on campus. So new researchers. And let me mention one of them, Carolyn Anderson, who is one of the gurus on coming up with novel drugs for cancer in the field of radiopharmaceuticals. And she's going to work closely with our MU Research Reactor team to come up with new drugs for cancer and other disorders. She just arrived August 1st. I was able to convince one of the data informatics gurus in the country, Dr. Russ Waitman, who was with me at Kansas, to again cross the state line and to join us at University of Missouri. He is a guru of delving into the electronic medical record and trying to find connections on the data in the EMR so that scientists can ask new questions about how to tackle diseases. He arrives actually yesterday. It's October 1.
Wow.
His first day on the job was October 1. And we've also recruited Henry Wan, who is leading he's an expert in the field of viruses. In the past, it was influenza. He's still going to do some influenza research, but he's also pivoting to study COVID research, and he'll have a place in the next-gen building. So we've actually been very busy recruiting scientists in anticipation of this. Some were in play before I got here, some I've initiated. And then we're looking at our areas of focus in our research endeavors, and we have plans to recruit in each one of the research focuses. And they are, and then I'll take a breath and I'll ask your next question. The areas of research focus are cancer, neuroscience, cardiovascular metabolic disorders, population health, and emerging areas such as virology and COVID-19.
Is that big enough? Is that building big enough to do all of that?
The building is amazing. It's 250,000 square feet. I don't think there's ever been a building like that in the country on a campus. And good word on that front from Burns and McDonnell, which are chief architects, and they've been building academic research buildings all over the country for a long time. And they said they've never seen a building that has all of the features which our building has in it. So it has wet lab space. We have partnerships, major corporate partnerships with Siemens, with Thermo Fisher. So we'll have one of the biggest research MRI research magnets in the country, a 17 magnet. We'll have one of the state-of-the-art electron microscopy core facility with Thermo Fisher. We'll have a good manufacturing practice lab so that we can, when drugs are coming out of the labs, we can prep them properly so that they can be on their way to first-in-human use. And then we're building a state-of-the-art next-gen clinical translational research unit where patients can come in to get the cutting-edge therapy. So all of this will be in the same building. The test tube work, the clinical work, the imaging work, and it's just very exciting.
Again, for our listeners, we're listening to Dr. Richard Barron, and he is the Executive Scientific Director of the Next Gen Precision Health Institute, which we've been focusing on, also the Executive Vice Chancellor for Health Affairs. All right, some quick questions here. One is still on track for the October 2021 opening?
As I hear every day from our construction team, we are on time and on budget. Okay. So October 2021. Yes, that's the date. And Dr. Choi will make sure that it's not a day later. And I'm on that with the team.
All right, because that's what we've been told over the last couple of years also.
Right.
And then also as far as the funding is concerned, what is the funding level? How is that playing out? I think under these economic conditions right now, people always worry about that.
Yeah. So the funding effort is healthy. The building will cost a bit over $200 million, and the funding is going to come from a variety of sources. MU Health Center has committed to funding a significant part of the building. We are working on a cooperative agreement with the Veterans Administration because we're going to have VA scientists who are on this campus. They'll be part of the building. There is some state funding that's been promised. Some of it we've already received. And then we're on a major campaign for philanthropic donations. Dr. Choi has already raised over $36 million, and he's got me out on the stump talking to as many of the MU friends as we can find to tell them about this exciting endeavor. So I think we're good on the funding.
You're recruiting, as you said, some of the scientists that you've recruited, some of the researchers who are going to be working there, based on what they will be able to do, either in helping to produce marketable products or helping to attract further research dollars. So you kind of on the promissory note to saying, come here. And as far as the funding of their salaries and what they're going to do, it's on the expectation of what they'll be able to produce in the near term.
That's very perceptive. You've done this interview before, haven't you? That's exactly how you hope this is going to go. You bring in the highest caliber talent, and those talented scientists are going to do two things. They are going to get big NIH research grants and other federal funding agencies. They're going to work with industry partnership and bring in dollars. And also they're going to create new things that have a potential commercial value in the healthcare industry, and that can bring in dollars. So that's one way. Also, I said earlier in the interview that the university can't be successful without a successful hospital. So we are absolutely dedicated to having a cutting-edge healthcare system at MU Health, and as that is successful, and it has been for a number of years now, that helps also feed the scientific endeavors and the recruitment of new faculty.
So where in relationship to the next-gen building would the Women's and Children's Hospital be built if it is moved back towards the existing MU Healthcare Hospital?
Good question. So, we are looking at a number of ways to consolidate our healthcare delivery so that it is so that it's streamlined and that we have a central healthcare delivery campus. We're still looking at all the possibilities for that. We're expanding our ability to do more surgical cases and hospitalizations at the Missouri Orthopedic Institute. We're redesigning some of our current space in our hospital, but we're also looking for new ways to consolidate. I actually I'm a neurologist, and I see both adult and pediatric patients with muscle disorders. So I actually see patients over at Women's and Children's. Actually, today is Pediatric Muscular Dystrophy Day, and I had to miss it for this interview, but I'll be there next month. So I'm absolutely committed to women and children's health care. There is an opportunity that we are still vetting to create a new women and children's hospital on this campus. We have to go in front of the Board of Curators, and we plan to do that in November to vet that concept. And I think it works. I think it will make us really stronger in women's and children's care if we can get that done. And if it happens, it would be in the space directly between the Next Gen building and the Ellis Fischel Cancer Center.
All right.
So that is the plan, but right now it's still a plan in development, and we'll know more in November if we're going to go forward with that.
We're almost out of time, so I don't have much time, but I'm just curious as to if the Next Gen Precision Health Institute had been up and running this year, would there be research there in trying to deal with the COVID-19 treatment?
Oh, absolutely. We're already doing COVID-19 research on this campus. I was just looking at our scholarly publications in that area. We've had over 60 publications in the last few months on COVID-19 and how it affects healthcare. I already mentioned we hired Dr. Wan, who's this major virologist that has been focused on influenza his whole career, but now is pivoting to COVID-19. He arrived actually several months ago, before COVID-19 hit, and so his lab is already pivoting to study that in other research space on campus. So, there's no doubt that if the building would have been built, Dr. Wan and some of the other immunology and virology team would have already been in that building, but that activity is already going on. So the opportunity with that building is new space to attract more talented faculty and to accelerate the speed of discovery even more.
I really appreciate the fact that you've given us this time today, and I hope that we can visit again because I like hearing these things. I think it helps to keep the community that is the town part of the town and gown atmosphere of a place like Columbia and Lawrence or many others across this country. But we need to hear of these kinds of things because I think it gives us hope for the future and also encourages us for what's happening right here, because the impact of what happens with healthcare from the university and with the university's research, that's an economic impact on the whole community. So, Dr. Barron, I hope we can talk again.
Well, thank you. I really appreciate the time, David. And in this really serious time of the COVID pandemic, it's just wonderful to be able to be at the University of Missouri and to keep our eye on our mission of improving healthcare, making new discoveries, and educating the next generation of healthcare professionals. And we're going to keep doing that, and we're also going to deal with the pandemic every day.
Sir, thank you, and we look forward to our next visit.
All right. Thank you, David.
Dr. Richard Barron, he is the Executive Vice Chancellor for Health Affairs and the Executive Scientific Director of Next Gen Precision Health Institute at the University of Missouri.